Welcome to Nutritional Interventions for Wound Healing. In today's presentation, we are going to be discussing wound care. Wound care is a complex process that has multiple factors that affect wound healing. We're going to review three types of chronic wounds that you will more than likely encounter in your nursing career. We will also be discussing three nutritional interventions to promote wound healing. This presentation will meet the QSEN Patient-Centered Care Competency and the Essential of Baccalaureate Education Essential Number 7. These are the objectives that were assigned to be reviewed prior to class. The first type of chronic wound we're going to talk about are neuropathic wounds or diabetic ulcers. These wounds are especially problematic because a lot of times the patient doesn't know that they have that wound until there's already an infection or problem. Also, with the decreased circulation, you're going to have slower wound healing. These are wounds that occur because the patient can't feel their feet a lot of times, and they'll be wearing shoes that are rubbing a place on their foot. Also, they can step on things and they don't know that they've injured the area. I had a patient once that soaked their foot for an infection and had an entire third-degree burn all the way around the foot because he couldn't feel that his foot was burning. Pressure ulcers are another problematic type of wound. This is when this tissue gets trapped between a bony prominence and the tissue dies because of the loss of circulation. It can also occur with shearing. You see a lot of these wounds in nursing homes with patients that aren't able to turn themselves, but they can also be present with patients at home that aren't being well cared for. The third type of wound is a surgical wound healing by secondary intention. Surgical wounds come open for many reasons, but you're going to be thinking infection, trauma, straining. This is why the doctor tells you to not lift anything greater than 5 pounds. Obesity can put tension on the suture line and it can come open. Fluid accumulation is another reason that a wound will come unapproximated, and that's why you see a lot of physicians inserting drains to help offset the fluid accumulation from the surgery. But once it comes open, it's healing by secondary intention. On this slide, you see some common interventions that you should be familiar with. I'm sure you've heard of them. And you also see the Braden Risk Assessment Scale. What I'm wanting you to put together with this slide is that the interventions that we do are affected by the Braden score. Most of the things that you think of have to do with pressure, moisture, mobility. There's very little about nutrition. So if you're scoring your patient at nutritional risk, you should really be asking yourself, what intervention do you need to be implementing to address that nutritional deficit? The three nutritional interventions that we're going to go over that assist with wound healing are increased protein, proper hydration, and blood glucose control, if applicable. Protein is the first intervention we're going to discuss. Protein is very important to overall skin integrity. That's why it can be used as a preventative measure and also a treatment intervention. When you're looking at the Braden score and your patient is scoring at risk due to nutrition, even if they don't have an existing wound, it's still appropriate to get an order for a protein supplement to increase their protein to protect their skin. Now, there's two ways that you can address the protein intervention. You can get a supplement or dietary increases, or really you could do a combination of both depending on the circumstance, whether you're preventing or if you're trying to treat an existing wound. Protein is one of the building blocks of wound healing, so I want you to imagine that you're going to build a brick wall. And so you go to build this brick wall, and you have all the bricks that you need and all the tools, but you have no mortar. You could stack the bricks, but it's not going to be a very sturdy and strong wall without that mortar. So that's why it's crucial to make sure that the patient has enough protein so that you're addressing problems, but you're also preventing more problems. The next intervention we're going to look at is proper hydration. Now, there's many reasons that proper hydration are important to wound healing, but we're going to look at some of the basics. Proper hydration contributes to your overall homeostasis. You want your body functioning properly at all times, but especially when you're trying to heal a wound. Now, we know with principles of moist wound healing that we want to keep the wound bed moist. We don't want it to dry out. If the body doesn't have the water or the fluid to pull to that wound bed, then it's going to dry out, and that's not good. Proper hydration also helps with overall skin integrity. When you're dehydrated, your skin becomes brittle and fragile and more prone to injury, whereas when you're hydrated, the skin has improved elasticity and is more resistant to injury. Proper hydration also aids with transport of the needed components of wound healing to the wound site. Going back to the brick wall analogy, I want you to think of how you're going to get your mortar there. Think of the hydration as the truck that's going to be delivering the supplies to the site, and then within the site. The last nutritional intervention that we're going to discuss is blood glucose control. Now, this is a very complex intervention, but we're going to try to keep it pretty simple for today. Uncontrolled blood glucose levels can affect your circulation, and they can also cause cell wall rigidity. Both those things will compromise and slow wound healing. Also, you have to think of it as if the body has to focus on correcting the blood sugar, it's going to have a decreased ability to focus on wound healing. Think of it as the amount of energy you have to expend. So if you have 10 energy points to expend for the day, and your wound is going to require 5 points, you should have 5 left over. But if your blood glucose is high and your body has to use energy to try to bring that down, maybe it has to use 7 energy points to bring your blood glucose down, and that only leaves 3 for the wound healing when it needed 5. So you've slowed down wound healing. Now, there are a lot of additional complex pathophysiological effects that blood glucose has on wound healing, but we're not going to discuss those today. In the next slide, you're going to see an interview with a wound care specialist from Advanced Home Care, Miss Peggy McCracken.
We're here with Miss Peggy McCracken. She's a wound care specialist that I worked with at Advanced Home Care. So tell us a little bit about your background in wound care.
I am a home care nurse, and the reason I decided to be wound certified is because of my patients that I took care of in home care that had wounds. And really, I noticed I didn't know what to do for them. I could call a doc and I could say, hey, this wound's not healing. And they'd say, well, what do you think it needs? And I had no idea. So I decided to go to school, and I researched which schools or what certification I wanted. And I chose to be certified by WOC and CB certification. So I went to Emory, and I also am ostomy and continence certified.
Excellent.
Which goes hand in hand with wound healing.
Yes, very much so. And you've been doing that about, you said 14 years?
Yes.
Okay. So we're talking with my students today about the importance of protein, proper hydration, and blood sugar control for wound healing. So with protein, why is that important for wound healing?
Well, it's as with prevention also. If you are malnourished or have a protein deficit, you're not going to heal as well. One of the things I like to see, even if they're not calorie or protein deficit, is to see that all wound patients be put on a protein supplement. My favorite one is Juven because it's geared especially to heal a wound.
Okay. And why is hydration important with wound healing?
Because it's not only important systemically, it is also important to keep that wound bed itself moist. If you have a wound bed that is dry and it needs to epithelialize, then that wound, especially if there's a scab there, because if you keep it moist, you're probably not going to get what they call dry drainage in that wound bed. And if there is like dry drainage, then in order for it to epithelialize, it has to migrate and actually lift that up in order for that epithelium to migrate across that wound. Also, we need to have proper hydration to make sure that we're getting nutrients, oxygen, and all that to via the cells, the blood cells carrying oxygen and all that to the wound so that you can get angiogenesis and other healing.
Excellent. So with blood sugar control, a lot of people wonder why that's important with healing wounds, specifically chronic wounds that are problematic.
Yes, I'm sitting here with a wound book. I was just telling Liberty that one of the things that I looked at a few minutes ago was burn centers and their burn patients. They like to have keep their blood sugars under tight control, and they like for them to be like at 110. They've kind of lowered their standards because it's hard to do that because of the hypoglycemic episodes that occur when you try to keep it that rigid. But at 150 is the goal these days. And if you do that, what you will find is that you will get better healing. And also, once you get through that acute burn stage, they go to rehab, if they can continue to keep those blood sugars at 150 or below, that they do better rehabbing. And that's like with any wound, because, well, we were talking about like your diabetic or your neuropathic wounds. A lot of times those occur because the patient can't feel. But also, if they do get a wound and they're one of these that don't look at their feet daily or real often, what will happen a lot of times is there will be a wound there, but if the blood sugars are high, then that cell wall has become rigid, and the small vessels, they can't get any circulation, and it becomes ischemic, and therefore it just deteriorates.
That's an excellent point with the not being able to feel. A lot of times these patients, until they pull their sock off and it's wet, they don't even know that it's a wound, so they don't know it's there until it's a problem.
And that's one of the things that I have always tried to get across, how important it is that you teach those diabetic patients to look at their feet at least daily. And if a lot of them will say to you, but I can't see them, teach them to use a mirror. There's other things out there that you can get a mirror with a handle that they can look at their heels, they can look at the plantar surface of that foot.
Well, I thank you so much. That was some excellent information from an expert. Thank you.
In today's presentation, we discussed why nutritional interventions play such a vital role in wound healing. We talked about how proper hydration and increased protein can help with overall skin integrity. We learned that increased protein can be used to not only treat pressure ulcers, but also to prevent. We also talked about how blood glucose control, proper hydration, and increased protein are all essential to create the proper environment for wound healing. Now let's see how much you learned from the presentation. For wounds other than burns, blood sugar should be kept at or below A, 250, B, 100, C, 110, or D, 150. The answer is D, 150. Which assist with skin integrity and wound healing? Select all that apply. A, carbohydrates, B, water, C, protein, D, fiber, E, country music. The answer is B and C, water and protein. Your post-lecture assignment is a discussion board, and the instructions are on this slide. This is a reflective exercise, and I don't want you to worry about references and citing unless you're directly quoting. I want you to concentrate on how you would implement this information and respond to your classmates. Thank you.